So a student of mine just asked a question about breaking down the general surgery PGY years. So let's just talk about general surgery residency. So going to be 5 years. Okay, so your PGY1, PGY2, PGY3, PGY4, PGY5. So each year is going to be a little bit different. So PGY 1 year, your first year, you're a quote intern. What do you expect? Well, you expect long hours, and I don't want to use this word, but there's a term called quote scut work. So it is what somebody considers to be maybe not so meaningful. So your main role is going to be doing note documentation, doing H&Ps, doing consults, putting in orders. This is the unfortunate truth of the hierarchy of surgery and learning, the nuts and bolts that come when you first step into a hospital. And I think the most important thing to learn during your first year is differentiating when a patient is, quote, sick and then not sick. So that, to me, number one priority, and definitely the role of our lovely PGY1 interns, okay? Second year, okay, so you're not an intern anymore, thank God. You're gonna start operating a little bit more, but you're still gonna be kind of the workhorse on the floor. You know, you're not like the number one guy in the OR by any means yet. Depending on which service you're on, that's gonna greatly vary. And you're still, again, in that kind of workhorse mode. Now, PGY3, this to me is an interesting one, because for me, PGY3 was the hardest year. And I always say to everybody that your third year as a general surgery resident is going to be your hardest year. And well, why is that? Well, you've been around for 3 years now. So all the attendings, everybody knows who you are, and they expect a lot out of you. However, you're still at the mercy of your PGY4 and PGY5 senior residents. So you're in this weird time where people expect everything from you, but you still don't know all that much, to be honest, and you're still expected to run the service. So third year, in my opinion, by far roughest year. Now's when the fun begins, PGY4. So PGY4 is when you really start to take control in the OR. You really get to start operating. You really get to be the primary surgeon and start to teach your intern and junior level residents, become a teaching assist. And then that only gets even better during the chief year, which for me was my favorite year and probably everybody's favorite year. As a chief resident, when you really take ownership of the service. We have a lot of autonomy here, so our chiefs truly run our trauma service and our acute care surgery service. And then there's a PGY 6 year, which I didn't write down on here, is our fellowship year. So for us, it's called surgical critical care. I'm the program director, and there you really get true autonomy. I rely fully on the fellows to run our surgical trauma burn ICU, and they do an incredible job. But third year, worst year. First year is bad, but no one expects you to be good. So it's different than that third year, which is really the worst in my opinion. I hope that helps for anyone that is on maybe some students that are applying to surgery, and for maybe some of our surgery residents at the end of the day, there is light at the end of the tunnel. There's light coming in right now just to show you. Look at that. It's beautiful. You'll get there. Just put in the work, 10,000 hours.